Well, hi, Dr. Holmes. Thank you very much for agreeing to do this interview. I'm going to ask you a few questions and get to know a little bit about you, okay?
Okay.
All right, so Dr. Holmes, can you tell us a little bit about yourself? Long or short, whichever one you'd like.
So my name is Cherie Holmes. I am an orthopedic surgeon in New Hampshire. I went to Georgetown Medical School and did my residency at Harvard and did 2 fellowships in sports as well as trauma. My trauma one was at Baltimore-Shock Trauma, and I practiced in the Navy for a while, and then came out, was in private practice, and now I've been with a large group, part of Dartmouth-Hitchcock.
Awesome. So just jumping right in, what does it mean for you to be a black woman in medicine?
So I think it's really important to be able to show others, not just folks who are going into medicine, but other folks around you, nursing, as well as people who are just everyday folks that you work with, that it is something that people can aspire to, and that I think it's great for others to be able to work with someone like me and realize that there is something different than perhaps what the majority offers.
Awesome. Next question. What's one word or phrase that describes your journey to where you are now?
It has been slow and steady, and sometimes it has had its obstacles, and yet as long as you persevere, you just have to keep doing that and you will get there.
Awesome. So what was your pathway journey to medicine? I know we talked about this briefly yesterday, but you can start high school, college, or even before. Give us a synopsis of your pathway into medicine.
So my pathway to medicine, my mother was a nurse and ended up teaching in a school of nursing, and that was really my first foray with medicine, and that was a passion for her, and I think it really rubbed off, and I decided that I wanted to go into medicine, but I wanted to be a physician. And luckily there were several other people in the family who were in medicine in one way or the other, and I just decided to persevere, go on to medical school, and while I was in medical school, I really, at that time, loved sports and thought I would do sports medicine, which I have continued to do. That's one of my 2 fellowships. And when I was in the Navy, I became very interested in trauma. I deployed to the first Gulf War, Operation Desert Storm, Desert Shield, and did trauma, and decided that I wanted to continue and do a trauma fellowship.
Awesome. So can you tell us a bit about what were your ups and downs, what were the victories and even struggles and hardships through the process you just mentioned for us?
So I think early on, the struggle was that you had to get through all of the pre-med things, and I saw a lot of people drop away from their goal of wanting to do medicine because of that. Then once I was a resident, or actually let me back up. Once I was in medical school, I had to do a certain amount of time in orthopedics if I wanted to go into orthopedics. And at that time, the person who was the chair was not particularly fond of women or African Americans going into orthopedics, and that was a major obstacle that I was eventually able to get around and got into residency. And then what I learned in residency is you have to really want it. You have to want to be a physician. It's a lot of long, hard hours. And when I talk to people who are doing it now and going through medical school or want to go to medical school and become a physician, I tell them you have to really wanted, because you can't be a physician part-time.
Awesome. Next question. So, right now you're very accomplished. What are some goals you have that you might have accomplished or that you have left to accomplish in the medical field?
So at this point, I am still a surgeon. I do less surgery than I did before. I've done my 20-plus years of doing sports medicine and trauma surgery. I have gone back to school. I've gotten a master's in healthcare management so that I've moved into a chief medical officer role. And that has pulled me away from as much surgery as I enjoyed doing, but I still do a little, and I still see clinic and see patients, and that's always very gratifying. At this point, as a chief medical officer, I'm much more interested in the way that medicine works and healthcare works. And so my goal at this time is to bring the organization that I'm with through a process which is changing all the time, of being able to provide quality, patient-centric care to the patients around us.
Thank you for that. Dr. Holmes, do you have any words of wisdom or food for thought for high school students, pre-med college students, or even medical students here today?
I think that if you want it, you need to pursue it. I think it's helpful to have mentors, to reach out, try not to just do it on your own. There are many people who have come before you who you can use and talk to help you get there. And you also have to recognize it's hard work, it's a lot of time, and that's where a lot of people decide, geez, I'm not sure I really want to do it, because it takes so much time and effort, but it is an incredibly gratifying field when you're in it.
Awesome. And you mentioned that it is very tough. It's very strenuous. So what keeps you going?
I think it's really the patients and the people that you interact with. There is an incredible feeling when you can provide quality care to someone. And in orthopedics, you can watch a child walk again. You can fix someone's arm. In sports medicine, you can get an athlete back on the field. You can get somebody who's unable to work back to work. And it's unbelievably gratifying, and you feel like you've been able to give them something that for a temporary period they lost. And there's nothing better than that feeling when you work with people to get them to that point.
Okay, great. So last question here. You might be a bit biased, but we ask every doctor this question. So what's your favorite organ system and why?
So I like bone,
Okay.
and otherwise I would not have become an orthopedist.
Mhm.
I think what I like the most about orthopedics and bone is that you get instant gratification. It's unlike high blood pressure and diabetes, where you can control it, but it's still there. I can take a broken bone and fix it, get it to heal, and the person is back. I can take someone with arthritis and do a joint replacement and get them back doing many of the things that they want to do. So it's instant gratification, and it gets people back to work, back on the field, whatever it is. It's a great feeling.
Awesome. Thank you so much for your time, Dr. Holmes. I really appreciate the video.
Thank
the interview.
you.
Thank you.